In other news now, an extra $1 billion, that's US dollars, needed for research into tuberculosis. That's according to the World Health Organization. It says the current spending is not enough to revive the fight against the disease, which has become prevalent since the COVID-19 pandemic. TB remains one of the world's deadliest infectious killers, with over 4,000 people losing their lives to the disease every day. Speak now to Professor Willem Hanekom from the Africa Health Research Institute, and he's based in KZN, but currently is at working and on work trip in London. Prof, good afternoon. Thank you very much for joining us. This coming Thursday is going to be World Tuberculosis Day. And ahead of this already, we can see the news coming out of organizations like the WHO warning us about the fact that TB is still very much with us, and somehow it may have been relegated to the margins as the world is fighting COVID-19. That's surely not a good state of affairs.
No, it's a terrible state of affairs. This is not what we want. Tuberculosis in South Africa kills 3 people every single hour. This is how common it is here. This is a crisis in our country. We really need to do something about it. It's a crisis globally. It kills 1.5 million people globally. And what has happened now with the COVID epidemic is that a lot of resources have gone towards care for COVID, which was, of course, appropriate. However, some of the resources have been taken away from looking after tuberculosis also. Perhaps it was also because people could not get to care because of lockdowns, etc. And that has manifested globally in that the TB death rate in the world has increased again. This hasn't happened for years. It's been coming down for years. So we're really in a crisis situation. This disease is a disease of the socioeconomically dispossessed, and therefore it's never really had the advocates to advocate for itself, and therefore it's never really had the funding for us to be able to control tuberculosis.
Yeah, last week I interviewed the CEO of Caesar Hospital here in Gauteng, the only hospital in Gauteng that can treat drug-resistant tuberculosis. One of the things that they saw a decline in people accessing the facility during the last 2 years in terms of TB, which tells you that there's a lot of TB going around that silently, while it's like the forgotten killer disease. And we are on dangerous ground when it comes to TB currently in the country.
You're absolutely right. And this has not only been shown in South Africa, it's been shown all over the world. Suddenly, we are diagnosing fewer people with tuberculosis. And this is going to manifest down the line, perhaps in a year or two, with big problems for us. So we actually, as a TB community in South Africa, we are going to focus on this very issue in a conference in September, the South African TB conference, to actually look at exactly what the impact of COVID has been and how can we get back on track. But as you say, Dan, I think one of the most important things is money. We need money to be able to control tuberculosis. And for years and years, we've only had about 50% of the amount of money that we need globally to control this disease. Yeah. In fact, the amount of money over the last few years has decreased in what we need to control tuberculosis.
Yeah, as I said in the intro, the statement we've seen from the World Health Organization saying that the world needs an extra $1.1 billion US in research and development alone. But of course, you need money, as you say, for TB diagnostics, for treatments and prevention. And that has come down quite a lot. I mean, ahead of September, I mean, should there be mobilization for more funds, for example, that are needed for TB research? What's your view, Prof?
Of course, I would advocate for this all the time. I would tell you, for example, I've worked all my life in tuberculosis vaccines, new vaccines to prevent tuberculosis. And the amount that has been spent on COVID vaccines is about 100 to 1,000-fold on what we spent on tuberculosis vaccines. The amount that we spent on HIV vaccines, for example, is 7 times what we spent on TB vaccines. It's a very underfunded area, and we need to mobilize funds in some way globally. There have been efforts, commitments from many states at United Nations meetings, but unfortunately, many of these commitments have not materialized, and some of that has been because the resources have been used towards COVID care.
And meanwhile, it's still the deadliest disease, killer disease, and it's remaining currently the forgotten killer, as one newspaper headline termed it last week here in South Africa. Thank you very much, Prof. Hanekom. Safe travels to you, and we'll talk to you, I'm sure, in the near future as you build up to that conference in September in the country.